So, good morning or good afternoon. So, this is just a continuation or additional discussion for Parma Benny. We're just going to talk about the anatomy of the circulatory system because introduction na natin to kung magba-blood smear tayo, mag-i-insight tayo for introduction ng venipuncture. Dapat alam nyo yun para pag nag-insight kayo, alam nyo yung flow ng circulatory system. So now, we have the three main parts of the circulatory system. We have the heart, blood vessel. So, ano ba yung main function ng circulatory system? So, una, ang main function niyan is, syempre, is circulatory system transport. Pag naman nagtransport, syempre, yung blood is carries oxygen from the lungs to all of the body's tissue. So, at the same time, pag nag-carries ng oxygen yan is while it picks up carbon dioxide from those tissue and carries it to the lungs to be removed from the body. The body. So, syempre, nagki-carry ng oxygen. At the same time, yung, di ba, pag nag-i-inhale tayo ng oxygen. And pag nag-exhale tayo, is naglalabas tayo ng carbon dioxide. So, once we inhale, yung oxygen na yun is dinadala ng blood natin. Galing from lungs, papunta sa iba't ibang part ng body tissues natin. Tapos, at the same time, nag-pick up siya ng carbon dioxide doon galing sa mga tissue, palabas naman siya ng lungs natin. So, isa yon sa transport. And also, it pick ups nutrients from the digestive tract and delivers them to all of the body's tissue. And also, since nag-carry siya ng nutrients from the digestive tract, dinideliver yan. So, yung nutrients na yon pag na-absorb na ng small intestines natin, dinideliver yan through blood para ma-distribute yan all throughout the body. And also, it carries metabolic waste. Which is, yung metabolic waste na yan is nire-remove the kidneys for removal. And also, nagki-carries din siya. Nagki-carries din ng hormones from endocrine cells to their target organ. Yan. And also, lastly, it transferred a variety of stem cells from the bone marrow, and other origin to the tissues where it can lodge and mature. Yan ang role sa transport. And also, since transport pa lang yan, madami na. Yan, transport pa lang yan, madami na. Then we have, the other one is we have protection. Sa protection naman, syempre yung blood, nagpe-play siya ng several roles. Pwede siya sa inflammation, which is a mechanism for limiting the spread of infection. Then, sa protection, meron di ba tayo sa blood na white blood cell? So, sa white blood cell na yan, dinidestroy niya yung mga microorganism and cancer cell and remove debris from tissues. Also, since white blood cell, nagkakaroon din po tayo ng antibodies and other blood protein, which is it neutralize toxins and help to destroy pathogens. So, 'di ba, yung pathogens natin, yan po yung mga parang invaders ng katawan natin. So, yung katawan natin, yung blood or circulatory system natin, it can release an antibodies for protection para mawala sila pathogen. And then, lastly, we have the platelets. Yung platelets is secrete factors that initiate blood clotting and other processes for minimizing blood loss. And contribute to tissue growth and blood vessels maintenance. Then, another one is for regulation. So, nire-regulate ng circulatory system natin is by absorbing or giving of fluid under different conditions. Yung the blood, capillaries, help to stabilize fluid distribution in the body. Tapos, syempre, 'di ba, meron tayong nare-regulate din yung katawan natin by yung buffering ng acid and bases and also yung blood proteins. Kasi mag-help po yan to stabilize yung pH. Stabilize the pH of the extracellular fluid. So, ayan. And then also, may cutaneous blood flow tayo, which is yung cutaneous blood flow is important siya kasi lalo na sa metabolic heat from the body. So, yung regulation ng katawan natin is mag-shift yung blood flow is nire-regulate niya yung temperature ng katawan natin, which is yung blood, magururut yan through the skin for temperature or heat loss. And also, yung magre-retain siya in deeper para mag-conserve pa ng heat, lalo na pag nilalamig. So, eto, we have hematology. It is the study of the blood and blood disorder. Unang isa-isahin natin to ha. Unahin muna natin si blood. So, si blood is, it is a fluid, which is, yung fluid na yan, alam naman natin na blood is a fluid. This is a fluid connective tissue consisting of plasma, red blood cell, which is, ang red blood cell is ang ating erythrocytes, and white blood cells is the leukocytes, and platelets, which is siya yung thrombocytes natin. So, yung main function is include po sa blood is transporting oxygen and nutrients to cell, removing waste product, and aiding in the immune responsibility, blood clotting. Wait lang guys. Sorry na putol. So, about the blood, so, since nga transport siya, yung function kasi ng blood is nagtatransport ng transport gases, nutrients, and yung waste product. Which is, it also transport yung mga processed molecules, and nagtra-transport din siya ng mga, kung may process, meron din yung mga regulatory molecules. Then, yung function din ng blood is regulation of pH and osmosis. So, ayan yung mga ng blood natin. So, there's a video about this. Please watch po. Thank you.
Blood is a body fluid in humans and other animals that delivers necessary substances such as nutrients and oxygen to the cells. In vertebrates, it is composed of blood cells suspended in blood plasma. The blood cells are mainly red blood cells, also called RBCs or erythrocytes, white blood cells, also called WBCs or leukocytes, and platelets. Plasma, which constitutes 55% of blood fluid, is mostly water, 92% by volume, and contains dissipated proteins, glucose, mineral ions, hormones, and carbon dioxide. All the blood cells families work together and maintain your body so that you are healthy and strong. Red blood cells transport oxygen to your body's organs and tissues. White blood cells help your body fight infections. Platelets are tiny molecules that stick up together and build a clot on bleeding wounds. All three cell types form in the bone marrow, which is the soft tissue inside your bones.
So, ayun, yung natin for the blood. And now, we have to talk about naman is the blood vessel. So, meron tayong tatlo. So, we have arteries, veins, and capillaries. Si arteries po, siya yung blood vessels na nagke-carry ng oxygen-rich blood away from the heart to various parts of the body. So, ang arteries po is, thick muscular walls that help to maintain blood pressure. While si veins, ang kine-carry naman niya is oxygen depleted blood back to the heart. So, unlike ni arteries, si veins is meron lang po siyang thinner wall, manipis lang siya, and may mga valve siya. Yung valves na yon na nandito kay veins is nagpe-prevent ng backward flow of the blood para hindi bumabalik. So, si veins lang po ang may valves. And then we have the capillaries. Capillaries naman po, this is a tiny blood vessel where the exchange of gases, nutrients, and waste product occurs between the blood and body tissues. So, since nga manipis lang po sila, tiny blood vessel, meron lang po sila na thin walls, which is yung thin walls na yon is nag-aalaw para magkaroon ng efficient diffusion. So, ulitin natin. Si arteries nagkikarry ng oxygen-rich blood away from the heart and then papunta sa iba't ibang parts ng body. Meron silang thick muscular wall, which is it helps to maintain the blood pressure. While si veins is nagkikarry siya ng oxygen-depleted blood pabalik ng heart, which is manipis lang po yung wall nila, thinner walls compared to the arteries, and also they have valves. Yung valves na yun is nagpre-prevent ng backward flow of the blood. And lastly, capillaries, maliliit or tiny blood vessels lang siya, pero nagkikarry sila ng gases, nutrients, and mga waste product occurs in between the blood and body tissues. Maninipis lang din yung wall nila. Why it helps? Kasi it helps to efficient diffusion. So, ayan yung blood vessels natin. Then, arteries. So, si arteries, blood vessel carry away from the heart. So, merong elastic arteries, which is, yung elastic arteries is para silang highways closest to the heart. So, ano sila? They are large and very stretchy, which is it helps maintain steady blood flow by expanding, kasi nga stretchy siya. Expanding and recoil with each heartbeat. While si muscular arteries is para siyang, isipin nyo siya yung main roads branching off from highway. And din. So, yan yung natin, which is, ito is a medium size mayroon silang muscles in their walls that can tighten or relax to control blood flow sa iba't ibang katawan iba't ibang parts ng katawan. And then we have arterioles. Si arterioles naman, isipin nyo, para sila yung mga smaller street, which is naglilid sa mga neighborhood, ganyan. Kasi since si elastic is para siya yung malaking highway, tapos si musculoskeletal para siya yung main road na nagbar-branch off doon from galing sa highway. Then si arterioles, siya yung parang street. So guys, syempre pag dumadaan yung mga blood natin dyan, so ayun yung isipin nyo. Then since arterioles po is para mga smaller street, they are tiny arteries that connect to even smaller capillaries, and they can adjust their size to regulate blood flow papunta sa iba't ibang areas ng body based on the body's needs. So ayan yung sa arteries. And then you can see here, ito yung mga iba't ibang part ng arteries sa katawan natin. Yan yun. Mga major arteries that we can see in the body: subclavian, axillary, brachial, radial, ulnar, internal carotid, external, left common carotid, brachiocephalic, aortic arch, pulmonary trunk, left coronary or right and right coronary artery, thoracic aorta, celiac trunk, splenic, renal, superior mesenteric, abdominal aorta, inferior mesenteric, common iliac, internal iliac, external iliac, and then pag lower limb naman, we have deep femoral, popliteal, anterior and posterior tibial, fibular, dorsalis pedis. So, ito pa yung iba. Yan yung arteries. And then now, we have to talk about naman the veins. So sa veins naman, the blood vessels carried towards from the heart. So we have venules. Ang venules naman is small vessels collect blood from capillaries and begin the process of returning it to the heart. So, dito, they are located at the end ng capillary bed. And nag-merge siya doon sa large bed. Yung si venules is very small vessel or small veins in the body. Si venules ang smallest veins in the body. Then we have small veins. Si small veins naman is sila yung nagre-receive ng blood, from the venules and gradually increase in size as they approach the heart. Then which is yung small veins, meron din silang thin wall na nagko-contain ng valves. So, yung valves nga na yon is nagpre-prevent ng backflow of the blood. So, yung small veins is nagme-merge naman siya papunta kay medium-sized vein. So, si medium-sized vein, this is larger than small veins. Kaya nga medium But, hindi siya ganun kalaki katulad ni large veins. Ito, si medium veins, nagko-collect siya ng blood from small veins and venules. Tapos, tinatransport niya to toward the heart. So, si medium-sized vein, katulad siya ni small veins, meron din siyang valve. Yung valve naman na yon is sinesecure niya yung blood flow is nasa tamang direksyon. Then we have lastly the large veins. This is from the word large, siya yung largest veins natin. Venous system, so it plays a crucial role na turning the blood pabalik sa heart. Tapos, ang example po nito is meron tayong SVC is the superior vena cava and IVC which is inferior vena cava, which is nire-receive nila, si superior vena cava is nagre-receive siya ng blood galing sa upper body and si inferior vena cava naman is nagre-receive siya ng blood from our lower body. So, the large vein have thicker walls than the medium size and they can accommodate a large volume of blood. So here are the veins that we can found in our body. So ayan, subclavian, right, almost lagi silang magkatabi ni arteries. Yan. So hindi ko na iisa-isahin. Nandyan po, naka-indicate yan. And then we have the capillaries. So, si capillaries naman po is blood flow from arterioles. Parang isipin natin to. Bakit blood flow from arterioles? Isipin natin, think of arterioles is parang maliliit na road leading to the capillary. So, etong capillaries natin to, nagka-carry siya ng oxygen-rich blood from the heart to the capillaries. And then, sa capillaries naman, dito nangyayari yung exchange ng occurs between the blood and tissue. So, yung exchange na yan happens, si capillaries is like small bridge connecting the arterioles to the tiny roads. Parang nagko-connect lang siya. So, dito, sa capillaries, dito nangyayari yung oxygen and nutrients is nagka-crossover siya from the blood to the tissue. Tapos, meron din, while yung waste product is namumove doon sa ibang blood. So, dyan nagkakaroon ng exchange. Then, we have the heart. So, sa heart, alam naman natin, it is a muscular organ na nagpapump ng blood through the body. So, it consists of 4 chambers or we have 2 atria or sa upper chamber natin, we have 2 atrium, right and left atrium, and 2 ventricles. We have the lower chambers, we have the right and left ventricles. So, unahin natin si right atrium. So, si right atrium, naka-receive siya ng deoxygenated blood, which is ipapump niya yan papunta kay si right atrium makaka-receive ng deoxygenated blood from the body, tapos ipapump niya yan papunta kay right ventricle. So, si right ventricle is which sends magsisend siya, yung napump na yan, masisend it to the lungs para maging oxygenated. And then, pag naman na-pump na niya papunta sa lungs, si left atrium is marireceive na niya ito papunta sa lungs para maging oxygenated. So, si left atrium, ang marireceive na niya is oxygenated blood na. Galing na sa, para di malito. So, RB papunta sa lungs, tapos papunta sa left atrium. Then, oxygenated blood na to galing sa lungs. And then, from left atrium, ipapump na naman to papunta kay left ventricle. So, dito, si left ventricle is distributes the blood to the rest of the body. Yan. So, syempre, in short, yung heart is works a double pump, right side pumping blood to the lungs for oxygenation. Ito, pag ang heart natin is nagpump sa right side, papunta kay lungs for oxygenation, ang tawag po natin dyan is pulmonary circulation. While pag naman ang heart is nagpump sa left side for oxygenated blood to the rest of the body, ang tawag natin dyan is systemic circulation. So, this continuous circulation ensure yung parang lahat ng cell natin is makaka-receive ng oxygen and nutrients that they need to function properly. So, ayan yung heart. Then, we have the cardiac cycle. We have diastole and systole. So, yung cardiac cycle po, it refers to the sequence of event that occurs during one heartbeat. So, meron tayong dalawang phase, diastole and systole. During diastole, yung heart natin is nagre-relax, allowing yung blood is ma-fill yung chamber. Tapos si systole naman is yung heart is nagko-contract. Magpapump siya ng blood out of the chamber papunta sa arteries. Then, since may dalaw tayong circulation, so kakasabi ko lang kanina, pag yung heart natin is nagpump sa right side, pumping blood to the lungs for oxygenation, that is pulmonary. And pag naman yung left side, pumping oxygenated blood to the rest of the body, that is systematic circulation. So, sa pulmonary is magpe-perform yan sa right side of the body, which is site of gas exchange, pump blood to the lungs, and then si systematic naman, performed by the left side of the heart, magsusupply naman yan ng blood all throughout the body. Yan. Then, ayan, ay mag-next. Wait. Then now, you can see here yung naka-circle po. Ito, pag galing sa taas, that is the superior vena cava. And itong sa baba, that is the inferior vena cava. So, si IVC ang ating largest vein in the body. Si IVC. So, it carries the oxygenated blood back from the lower part of the body papunta kay right atrium of the heart. So, dito, yung blood is carrying carbon dioxide. While si superior vena cava is above the heart, nagkikarry send the oxygenated blood from the head, arms, papunta kay right atrium. Then, ito yung parts natin. So, ulitin na natin from makaka-receive ng blood. It's either from IVC or SVC papunta kay atrium. So, si atrium, ayan, yung blood niyan papunta kay tricuspid valve. Ito po sa atin, ito yung valve ni right atrium. Then, papunta kay right ventricle. Tapos, from right ventricle, papunta dito, may valve po tayo, which is the pulmonary valve. Papunta kay pulmonary artery. Yan yung pag na-receive galing kay superior and inferior vena cava. Tapos naman, pag naman ang na-receive naman natin is oxygenated naman po, syempre, from the lungs, papunta na yan kay left atrium. Tapos, may valve tayo, mitral valve. And then, yan, papunta kay left ventricle, papunta sa aorta para ma-distribute all throughout the body is meron din tayong valve dyan. Then, ito is pulmonary circulation. Pulmonary capillaries, so the O2 is loaded from the alveolar air into the blood, while yung carbon dioxide natin is loaded from the blood into alveolar air. Kasi yung lungs, in the lungs, yung blood is doon. In the lungs, the blood exchange the carbon dioxide and it is carrying oxygen. So, ganyan sila magpalitan. Yan. And then, we have here is the ganun ulit, parang circulation. So, the blood is returned from the body, papunta kay, ito yan, IVC, yan. After nyan, magpapas yan kay right ventricle. Tapos, yung blood is ipapump yan, papunta ng pulmonary trunk. Tapos, the pulmonary trunk, i-divide it into right and left pulmonaries, artery. Then, which carry for blood to the lungs and the lungs. Tapos, from the lungs naman, may capillaries tayo, carbon dioxide is given off and oxygen is picked up by the blood. So, there is no blood no rich oxygen flows into, pag na-pick up na yan, papunta kay, kapag exchange na, papunta kay left atrium, tapos papunta kay left ventricle, then ipapump niya yan, papunta kay aorta, and then madidistribute ulit through all that. So, the full oxygenated blood now flows back to the left atrium of the heart through the pulmonary artery. So, paikot-ikot lang po yan. Cycle lang po yan. So, ulitin lang natin. Systemic circulation is a flow of blood through the blood vessel that carry blood from the left ventricle to the heart, to the tissue of the body, back to the left atrium. So, ayan, naroon tayo. The oxygenated blood leaves the left atrium, oxygenated blood, the atrium, and maano natin si mitral valve. Si mitral valve is also known as bicuspid valve. Ay, sorry, hindi na babura dyan. Bicuspid valve. Then, ayan, ipapump niya ulit, papunta kay left ventricle, and then pump. Yan. Kay aortic valve. Yan. And then, aorta, then distribute niya na ulit yan. Then, ayan, systemic circulation. So, aorta is the largest artery. Since ang aorta natin is the largest artery, then meron siyang ascending aorta, which is yung ascending aorta leaves the curve, ascending aorta, curves into a U shape, making an arch. So, ascending aorta. Tapos, meron yung aorta natin is kaya niya mag-branch out. So, merong brachiocephalic or tinatawag natin innominate artery, which is divided into two. We have the right subclavian artery, and we have na nagsusupplies ito ng blood from the right arm. Right arm and upper torso. Then we have the another one is right common carotid, which is nagsusupply naman ng blood artery that supplies the head and neck. Yan yung kay brachiocephalic. And then now we have the left common carotid artery is nagsusupply naman ulit siya same with head and neck. Then si left subclavian artery naman left arm and upper torso din ng left side. So, subclavian po means it is located below the clavicle or the collarbone. Yan yung 3 branches natin ng aorta. Then again, descending aortic artery is maglilin down through the diaphragm, chest into the abdomen. Then, meron 1/5 to 1/16, 1/5 to 1/3 na blood magpapass through the renal artery. Doon, which is sa renal artery, which is kidney, is maano na yan siya, mafi-filter na siya ni kidney para maging waste product. Then, si descending aorta artery continues downward papunta po sa abdomen. So, pagdating sa abdomen, meron tayong dalawang split sa abdomen. Meron yung pag nag-split po yan, ang tinatawag natin dyan is aortic bifurcation. Bifurcation. Ito yung sinasabi nating split of major branches. So, dyan may 2 branches tayo ng iliac artery. So, ulitin natin, si aortic bifurcation is major arteries na nag-split po yan in the pelvis, supply blood to the lower abdomen organ. So, ayan, bifurcation. So, ito ang sinasabi natin dito. Natin makikita si aortic bifurcation. Split into 2 branches ng aortic. Then, ayan. Nandito si aortic bifurcation, ha? Diyan natin makikita. So, split of the aortic. Then, ayan. So, left iliac artery is nagsusupply ng blood from the left leg or sa left side natin. Wait. Sorry, ito yung right pala, ito yung left. So, dito, iliac artery natin, left and right. Pag sa right, sinusupply niya yung right side, and then sa left side. Then, here is the, superior vena cava or inferior vena cava, papunta kay right immune, magpapump, dadaan kay right cuspid valve, and then right ventricle, tapos pulmonary valve, pulmonary artery, papunta kay lungs, and then pag kay lungs, papunta kay left atrium, oxygenated na siya, tapos mayroon ditong mitral valve, tapos to left ventricle, papunta naman dito is si aortic valve. Yan. Papunta kay aorta, and then the rest of the body. So, yan.
Arteries are blood vessels that carry blood from the heart to the entire body. In arteries, the blood is mostly oxygenated. I say mostly because there are two exceptions where arteries carry deoxygenated blood. First is the pulmonary artery, which transports blood from the heart to the lungs, and the second is the umbilical artery, which carries blood from the fetus to the placenta. Veins are blood vessels that transport blood from the body to the heart, so it mostly carries deoxygenated blood. The pulmonary and umbilical veins instead carry oxygenated blood to the heart. Veins also have valves to prevent backflow and are less muscular than arteries.
The next.
The circulatory system comprises blood, blood vessels, and the heart. The heart is the central organ for pumping the blood throughout the body. Heart is made up of strong cardiac muscles. Heart pumps liquid blood, a tissue which transports nutrients, gases, waste, etc. along with it. The right upper atrium receives deoxygenated blood from whole body, which is pumped into right ventricle below, and it sends the blood to lungs for oxygenation via pulmonary artery. After oxygenation, blood travels through pulmonary vein and is received in upper left chamber, that is left atrium, which pumps it into left ventricle below. Then it is pumped into aorta, which is source many arteries which carries oxygenated blood to different parts of body. Arteries get divided into very narrow blood capillaries where exchange of substances takes place. Capillaries forms a web-like network to reach maximum cells. Capillaries join together to form veins. Isn't it a sophisticated system?
So, ayun yung for the capillaries and yung veins and arteries. So now, since we already talked about that, the circulatory system is dapat malaman natin kung ano yung mga venipuncture site na kailangan natin ma-familiarize. So we have median cubital or vein, so inner elbow, often preferred for its size and stability. So it is located in the antecubital fossa. So this is relatively large and tend to be more stable. So it is make it mas easier siya for the healthcare professional to access the median cubital. And then we have the cephalic vein. It is outside of the arm, alternative in the median cubital vein, it is inaccessible. So, yung veins dito is nag-run along the outer side of the arm. So, good alternative siya for if yung medial vein natin is hindi accessible. Mas maganda si cephalic. Pag hindi available or hindi ma-access si median. Then next, we have the basilic vein. This is the inner side of the arm, considered a secondary choice. Situated along the inner side of the arm, and the basilic vein is another option for venipuncture. So, ayun. So, it may be, etong basilic vein natin, it may be chosen when other veins are difficult to access. So, through it is often considered the secondary choice due to proximity sa nerves niya. Then we have dorsal hand veins, back of the hand. So, used in specific cases. So, in some cases, particularly sa mga blood test natin, or other side, it is not suitable. Di siya masyadong ginagamit. Pero kung talagang wala kang choice, is ito yung madalas. Lalo na kung laging nagbabulge or pumuputok yung vein. Then we have external jugular vein, neck. Usually is a specific medical situation. So, usually po, lalo na yung mga dinadialysis, ayan. Pero yung kukuha ka ng blood, normally baka naman may mas magandang access pa. So, last resort na to, pero pag may mga medical condition na lang yung mga pasyente. And then, this is the characteristic of a good vein. So, it should be visible. So, easy visible veins through the skin aid in accurate. So, maganda din siya sa needle placement. And nakakapa, palpable, which is easily felt. So, di ba kinakapayan? To enhance accuracy of needle insertion. And we have elasticity. So, elastic. Hindi siya yung basta-basta nagko-collapse during the procedure, allowing for smoother blood flow. And then yung size, syempre, the larger the vein, mas maganda. Kasi the larger the vein, often prepared easier blood flow, and nagre-reduce po siya ng hemolysis. Yung size kasi is, maybe it can differ or magbe-base po yan sa patient age and condition ng pasyente. Then we have the stability. So, mas maganda stable yung veins na pag-i-insightan natin or tutusukan natin kasi may prone kasi na medyo gumagalaw siya. Meron pang term doon na parang umiiwas yung ugat So, may mga ganon. Then we have deep vein. Is reasonable siya pag sobrang malalim, is deep beneath the skin surface, preferable. So, there are too deep or too superficial. And most, parang challenging siya, depende sa position ng lalim ng mismong vein. Then, accessibility is the easier access location is we have antecubital fossa, may make the venipuncture process more comfortable and efficient. And we have health of the vein wall. So, the healthy the vein wall, the less damage it can be. So, during the venipuncture process, kailangan natin ma-reduce yun. So, syempre, the more na healthy yung veins natin, is the more na madali natin makakapag insight or makakatusok tayo doon sa vein na yun. Then, veins to avoid natin. Una, is iwasin natin yung malapit sa joint. It can be more difficult kasi mas madalas na may joint, mas natutupi, mas nagagalaw. So, it result kasi din sa discomfort ng patient kung nasa hindi masyadong magagalaw ni patient. And we have na iwasan pag may veins is over the scar or tattoos kasi pag may scar or tattoos po is it can alter yung texture. So, mahirap ma-visualize yung skin kung tama bang veins ba yung tinututukan kasi may tattoo siya or baka may scar siya. It make it challenging to locate or puncture the vein accuracy. Then you have the veins on the dominant arm of a lymphedema patient. So, individuals may lymphedema or parang merong mga bukol, ganyan. It is often advisable to avoid venipuncture to dominant arm para ma-reduce din natin yung risk ng complication. And then we have veins over the nerves kasi we have to avoid the veins that run directly over the nerves para ma-help natin yung mga nerve, maiwasan natin yung nerve injury or discomfort during the venipuncture process. And then we have superficial, extremely superficial vein may be prone to rolling, making them harder to stabilize during venipuncture. And then, lastly, is we have to avoid the areas yung may mga skin infection or lesion. Kasi, since may infection sila, lesion or mga dermatitis, is kailangan natin siyang iwasan para mas maiwasan din natin or ma-prevent natin yung introducing infection to the bloodstream. Then, here is a video sa,
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to go over the veins that I love to use whenever I'm drawing blood or starting IVs. So in order to be successful whenever you're drawing blood or starting IVs, you really have to know a couple things. Number one, you need to know the name of the vein that you're going to use and its location, along with what can that vein actually handle. For instance, some veins can only handle about a 20 or a 22 gauge IV cannula versus some of them can handle 18 gauges, 16 gauges. So you really want to know which veins can do that. Now, what veins do I love to use whenever I'm drawing blood or starting IVs? Okay, number one, which I think the consensus is probably the same for this, is the median cubital vein. This is, here in a moment, you're going to see a large vein right in the bend of the arm, and it's perfect for drawing blood. I also like to use the accessory cephalic vein along with the median vein of the forearm, and of course those hand veins, the dorsal venous network. So we have our tourniquet on up here on the top of the arm, and I want to show you these veins. So first I want to show you the media cubital vein, and it is located right here, and as you can see, it's nice and large, perfect for those blood draws. And it arises out of your cephalic vein, which is right here. Now this is our patient's left arm. So on the right arm, it's going to be the opposite. But we have the cephalic vein right here, and then over through here, you can't see it as well, is the basilic. And where the cephalic and the basilic start to connect is here at this median cubital vein. Now this vein, like I said, great for blood draws. You can use it for IVs. The problem with it though is that it's in the bend of this arm. So as the patient is eating, moving around, getting up, it's going to cause them a lot of pain, and it can infiltrate and mess up the vein. So unless it's like last resort, you can't find any other veins on this arm, or the patient needs like a CT-PE protocol with an 18 gauge and one of those large veins, you can go there, use it, and then just take it out and go somewhere else. But I like to keep that available for blood. Next is the accessory cephalic vein, hence its name. It's coming off of that cephalic vein up through here. Now this is really one of my favorite veins to start IVs in. Number one, it doesn't really roll. It's easy to stabilize. You're not gonna stick the needle in there and it rolls to the side. Don't you just love when that happens? No, not really. And it's a relatively large vein, so it can easily hold an 18 gauge. Now the thing is, whenever you do use this for IVs, because it starts up in here, don't go in this bend of this arm. Go down, because it comes down, and you can just stick your IV right there, and the patient can move their arm, bend it. They're not going to have problems. So this is really a good vein. Another vein I like to use is located on the forearm, so we don't have a bend of an arm causing the patient issues. And it is the median vein of the forearm, also called the antebrachial vein. And it is this vein right here. It comes out of the palm of the hand. Now, as you can tell, this vein is not as big as that accessory cephalic and that media cubital vein. So whenever you go to stick this for like an IV, you want to probably pick like a 20 or 22 gauge instead of an 18 gauge. I have seen a limited amount of 18 gauges in this vein because, you know, everyone's anatomy is different. Some people have bigger veins there. So you want to think about that. Another thing is that these veins can run deep on patients who have a lot of sub-Q fat on their forearms. So you might be able to see the vein, but whenever you go to stick it, you don't immediately get that blood draw because the vein's a little bit deeper. So keep that in mind. And that also is true for these veins up here in the bend of the arm as well. And lastly, the veins of the hand, the dorsal venous network. And these veins are great for drawing blood, starting IVs. But some things you want to remember. Okay, first of all, these veins, like how this patient has their hand open, if you go to stick a needle in this vein with the hand in this position, this vein is just going to roll. See how that rolls like that? What you want to do is you want to stabilize it. So have them make like this light fist. And look, that keeps that vein nice and still while you go with the needle and try to draw blood or advance a cannula. Now I have a whole video on how to prevent rolling veins if you need some more tips on that. Another thing to remember is that these veins, sometimes they're really superficial on people, like here. They're nice and engorged and healthy looking, so they'll be great for an IV or drawing blood. However, on some patients who have a lot of sub-Q fat on the hands, they're hard to get to, they're super small or like very fragile and they blow easy. So always look at that. Look at the health of the vein before you try to stick it with a needle. Now, when choosing a vein, when you're starting an IV, there are some things you want to keep in mind. Number one, you want to ask yourself, okay, what's this patient here for? Are they just here for like a short stay because they need a quick procedure, or they're just here for observation? Or they're going to be hospitalized because they need treatment. Maybe they need some blood products, or they're going to have to get some vesicant type drugs like potassium, vancomycin, just to name a few. So you want to select your site and your size of your needle appropriately, because for instance, vancomycin is really hard on the veins, and you want to use a large vein rather than a small vein. Next, ask the patient where they prefer that you draw blood or start an IV, because patients tend to be experts on where they know that you're going to be successful at getting that IV or drawing blood. And some patients love to have IVs or blood draws in their hands, while some prefer that media cubital vein. That's the only place they want blood drawn, and that's the only place they want an IV. So always ask your patient. And lastly, sometimes you're just going to have to draw blood or start an IV where you can, because if you're working with patients who have severe cardiac disease or renal disease, they really don't have much to stick. They're very, very limited in where you can even get IV access. And I've seen IVs in creative places like in the feet, in the little fingers, on the arms, up in the neck, anywhere you can get them. So always keep that in mind. And if that does happen and your patient is needing lots of fluids, IV drugs, things like that, you want to get with the physician and you want to ask, hey, is this patient a candidate for a central line? Because that may benefit the patient a little bit better. Okay, so those are some tips on choosing veins when starting IVs or drawing blood. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
So, ayun, we have to familiarize kung saan yung mga site na dapat nyo malaman for venipuncture, kung saan kayo mag-i-inside, saan kayo tutusok. So, lahat ng yun is may mga factor yan before kayo mag-proceed sa ganong sa pag-inside, paglalagay ng pag-check ng line. Kasi sa atin, as a rad tech po, is most likely mas pag-contrast administered procedure, doon natin kailangan i-check yung line kung okay or not bago tayo mag-proceed sa pagpupush ng dose. So, that's it guys. If you have any question, you can message me or PM me. So, thank you guys for listening. Have a great day ahead.